Hello, today I want to talk about symptoms, illnesses, and diseases to give you a bit of medical vocabulary for your work in the doctor's offices. So let's start. First, the medical assistant welcomes the patient and asks a few personal details before asking about the symptoms. You can ask about the symptoms with the following questions. What's the matter? What's the problem? What's wrong? Or what are your symptoms? The patient could answer with the following sentences. I've picked something up. I have or I've got. I came down with. I feel bad, terrible, awful, miserable. I'm suffering from. Sometimes it's the case that the patient comes as an emergency. Then it's very acute, it's very urgent. Patients are sometimes in heavy pain, or they could have problems with breathing, so they can't breathe in or out. Sometimes they have problems with their heartbeat and that they are very anxious because of that. So they are afraid and scared. Also, they could bleed a lot. These are all emergency, so you need to act directly and to give an appointment, and you shouldn't send the patient away. So we have three different kinds of things that we are dealing with in the doctor's offices. First are injuries, second are illnesses, and the third one is diseases. The difference between illnesses and diseases is not a big one. Generally, illnesses are more short-term and acute, and diseases are more chronic and long-term. But it's not always like that. So let's have a look at the injuries. So patients could come with a wound. A wound could happen from different things. So you could burn your hand, for example. Also, you can cut your finger. Both happens when you are cooking. Also, you can have a blister, for example, at your toe or your foot when wearing not suitable shoes. Those wounds are sometimes bleeding and they can inflame. Other injuries that could happen are you could break your leg, for example, or your arm. You could sprain the ankle. This is not as severe as breaking the leg, but still it hurts a lot. If you have sprained or broken your leg or the ankle, it generally has bruises. That means that the color of the joint turns into blue and it's swollen. That means that it's bigger than usual. Sometimes if you have an injury, you hit your head, then you might feel dizzy. So you have problems in standing and you sometimes pass out or faint. That means that you lose your consciousness and you fall on the floor and people are talking to you. What happened to you? You cannot speak. So that means that to pass out or to faint. So more often you are dealing with illnesses in doctor's offices. Illnesses happen if you catch a virus, for example. These are infections. You can also say contagious diseases. You catch a virus, for example, the cold or the flu. If you have the cold or the flu, you might have the following symptoms. You could have headaches. You can also have a sore throat. That means that your throat is red and it hurts. Sometimes it happens that you have a high temperature or fever, especially if you have the flu. Often you are feeling weak and very tired. Also, you can suffer from a runny nose or a blocked nose, which is the opposite one. So a runny nose, you also have it if you have an allergy. So your nose keeps running. And if you have a blocked nose, you cannot breathe properly. If you have the cold, sometimes you are coughing a lot. That means like doing that a lot. Another infection that could have is the measles. If you have the measles, you have also itchy rashes. A rash is when you have like red dots on your skin, and sometimes these are itchy. That means that you need to rub it and you have this itchy feeling and you cannot stop just like rubbing your skin. Another infection is food poisoning. Food poisoning is very ugly. So often you have stomach aches, sometimes cramps in your stomach. You often vomit or throw up your food, and you have diarrhea a lot. So you lose a lot of water, and that means also that you feel very weak, and sometimes you also pass out because you're missing fluids and you cannot drink enough because you're vomiting all the time. So this is a very ugly disease or illness, and patients are coming into the doctor's office sometimes. Now let's have a look at the diseases. So diseases are more chronic and long-term, as I told before. And some of those diseases I want to give it to you. So diabetes is a chronic disease. Cancer is a chronic disease. Backaches or muscle pain could be chronic. So there are different types of diseases that comes along with backaches and muscle pain. Also, coronary heart disease is a chronic disease, and people coming into the doctor's office to have their blood checked, and for example, with diabetes, the glucose level needs to be checked. So these are the three main types of things that you are dealing with in the doctor's office. Before coming to an end, I want to give you a bit of vocabulary about sensation, pains, and aches. So pain and aches, it's just the same. You can use aches or pain. There is no difference. So patients often use those expressions to describe their pain. They can say, for example, it's prickling or tingling. That means that's a little bit like an ant is walking over your skin, or the expression it's like pins and needles is also very common. In German, it's like es kribbelt. If a patient says it burns or bites, that means that's a really sharp pain. It's like a burning sensation. It describes it like the best. Es brennt in German. Also very important, because it's also kind of an emergency, if you have a numb feeling, That means that you don't feel anything in a special area. It's taub. Also, they could use those following words. They could use I'm in heavy pain. That is an emergency, as I said before. So patient should be treated immediately. Sometimes they use the word dull pain. Dull pain is a pain which is not in a fixed area, so it's more a greater area. Ein dumpfer Schmerz. This expression sharp pain, piercing pain, describes a pain which is in a fixed location and it's very sharp. So it's ein stechender Schmerz. The last word is the throbbing pain. Throbbing pain occurs when something is inflamed. For example, if your finger is inflamed, then sometimes you feel your pulse in it. That means that you feel your heartbeat and it's going like boom, 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 boom. This is the throbbing pain, ein pochender Schmerz. So now I'm at the end of my presentation. I hope you learned a bit new vocabulary for your work in the doctor's offices. And yeah, wish you a nice day. See you soon and goodbye.